Hey guys, Dr. J here with Miss Karen Lee from Inspire Medical. And guys, we're going to discuss with you some different Q&A on aesthetics today. So Miss Karen, tell the audience, give them a little bit of background on your experience with aesthetics and some of your postgraduate education that you have on that.
Okay, so I went on to go to specific classes and was certified in all of the aesthetics,
Okay.
as far as the facials, the Botox, Juvederm, and have also went through further classes since the very beginning 15 years ago.
Okay, so you've been doing this for about 15 years. Okay,
Yes.
awesome, good. So Ms. Karen's obviously very well versed in this, has a lot of experience in this, and that's very important, obviously, because when we go through these procedures, it's comforting to know that we have somebody that's working on us, that we're not the first ones that they've been working on, that they've been doing this for quite some time. And that was one of the things that attracted us to you, is your experience. We wanted somebody that, again, was very well versed, and that's somebody that that had a tremendous amount of experience and confidence in this. So the next question really would be, if a person, again, is they're contemplating, maybe they look in the mirror and they see that they've got their face is aging a little bit, right? We all go through this. Maybe they're seeing there's a few fine wrinkles. Maybe the skin firmness is not what it once was. But let's say again they really don't know for sure what they need, because obviously, as you just mentioned, there's a lot of different procedures. So if I'm just really, I don't know what I need. I just know that I need to look a little bit more youthful. Talk with us about the process. Like, obviously, if a person calls in and says, I don't know for sure what I want, but I would definitely like to find out a little bit more. How does that work?
Okay, well, I don't know I'm not going to know what you need either until I see you in person.
Okay.
So, that's why we give a complimentary
Consultation.
consultation, and you come in and together we decide what's a good plan for you.
Okay.
What are your goals, and how are we going to get there, and how are we going to fit that into a budget that fits your needs?
Awesome. Good. And that actually, you just answered a question that a lot of times gets brought up, which is, well, how much is it going to cost? And like you just said, there's no way to know that, right? I mean,
Right.
because
Until you come in here and we see
That's
exactly
right.
what you need and what we can do for you.
right, because there is no one size fits all in this, right?
No.
It's all customized. And I love what you
To
said.
each person.
Yes, and I love what you said about, because there's an art to this, and
Yes.
that's part of where the experience comes in too, because for you to be able to say, my goal is twofold. It's to meet your needs, to get you what you're looking for, but a very important part of that is to fit it within your budget. Because
Exactly.
obviously if we can't fit it into the budget, it's all for nothing, right?
Exactly.
So, and again, that's feedback that we get from patients a lot, is they'll go, Karen's awesome because number one, she's really good at what she does, but she really was able to work within a budget that I was comfortable with. And that's very important. So again, that's another little bit more kudos to you. Okay, so let's say again so I call in, I come in for a complimentary consultation, and I think you'd said before, so basically you just have me kind of look in a mirror and say, what do you see, right?
Exactly.
Okay, so then let's walk me through again a couple of treatment options. Let's just kind of start at the top. Maybe
Okay.
we'll say the most common things that you'll get from especially a first-time patient. They're coming in for the first time. They're, and this is a relative term, but they're in, maybe they're in their late 30s, early 40s. They're just starting to see a few things. What's the most common thing that you encounter that patients
Well,
want?
you're showing me right now, and it's usually the
Uh-oh.
lines, they're called 11s, the glabellar lines between the eyes. Also the crow's feet, okay? And so that is usually either Botox or Juvederm, depending on how deep the lines are, what we can do. We'll decide that together also. That is one of the top things.
Okay.
So, and Botox is very safe. They've been doing it for 50 years.
Mm-hmm.
If it's used accordingly to Allergan's regulations, there's very few side effects from that.
Okay.
It works very well.
So for those areas you just pointed out, Botox was typically the most preferred method.
That, and there's also, some people prefer to use the dermafiller.
Okay.
And I'll tell you why. The dermafiller is made of hyaluronic acid. Our body makes hyaluronic acid. Okay, so some people like to use that form of method besides using the Botox, and either one is fine
Okay.
and has great results.
Okay.
So
Perfect. What kind of discomfort or pain? Like if I'm
that's a big question.
yeah.
We do everything that we can to make our patients comfortable here.
Sure.
And that being said, we use topical anesthetics,
Okay.
and we use also ice, and that always helps.
Okay.
But we also, the products that we buy, yes, we spend a little bit more on it. We don't charge you for that. But they have actually, lidocaine in there, a numbing agent
Okay.
that helps you to be more comfortable.
Okay. Cool. So you would say that, just again from all years of experience, I guess, is it safe to say that you don't typically run into a person that says, oh my gosh, I can't deal with the pain?
No, and when derma fillers first came out, we started doing around the lips, and
Mhm.
we would have to do it dental down. Okay, so this
Okay.
is kind of telling how old I am. But we would actually have to do injections in the mouth to numb the whole mouth.
Okay.
Well, now they've come out
Okay.
where they have it in the syringe.
Ah.
Plus, we do the topical, and like I said, it's just so much better.
Okay.
I never had anybody that yes, it at times can be a little uncomfortable, but it's nothing that anybody
It's
cannot.
tolerable. I'm hearing you
It's
say
very
it's tolerable.
tolerable.
Okay.
Very
Okay.
tolerable.
Especially given the results that obviously they're going to get from it.
It's worth it, and they come back. They want to,
Absolutely.
after a year, they, a lot of
Okay.
that comes back. They want to get it again.
So talk to me about that real quick. A couple maybe the other real common procedures, and talk to me about how I get the most longevity. Because I understand, correct me if I'm wrong, but things like Botox, they kind of build on, that treatment kind of builds on itself, right?
Well, the longer that you do it, a lot of times the longer that you can go
Okay.
before you have to get it again.
Okay.
But Botox is also preventative
Okay.
because it
Yeah.
does keep you from making those motions that cause the wrinkles in the first place. So, so you're doing a twofold there.
Okay, I gotcha.
Okay. But typically, Botox goes from anywhere from 4 to 6 months.
Okay,
Okay. Now the derma fillers, they actually last longer.
Okay.
You want me to talk about that?
please, yeah.
Okay, so we go through Allergan for the most part, and they have for different areas that we do the derma filler, they have different names for them. And they actually last longer in different areas too,
Okay,
because they use a larger molecule for
Gotcha.
the hyaluronic acid. But that being said, one of them is like if we do the cheeks, we give you back your apple in your cheek,
okay,
which it kind of pulls everything up when you do that too.
gotcha.
All right, pulls it out and up. That lasts almost 2 years.
Okay,
Okay, if you do Volbella, which is it's still all hyaluronic acid but a different formulation, in your lips, say, that lasts around a year.
okay,
And if you do parentheses lines, marionette lines, all of this, then that's going to last anywhere from 1 to 2 years.
okay.
So
Quickly, talk to me a little bit about PRP, because I know that's something again that you all doing. Yeah.
yes, PRP is for the whole face.
Okay,
PRP, what we do is
so that's platelet-rich plasma for those of you that don't know, and it's autologous, we call it. So we draw your blood, spin it
That's right.
down, and then those platelets is what has the growth factors in it, correct? That actually does the healing.
It does.
Okay,
So when you come in, we've got different things that we can do with microneedling.
okay,
That's one way to
okay.
get it into deeper surfaces of the skin.
And that's an instrument that you use on the, okay,
Right,
okay.
right, a microneedling. So, and of course we numb you first and we get you as comfortable as possible. But we can do injections with those PRP, and we can do the microneedling.
Okay.
Okay, so that over time
Mm-hmm.
really can make a huge difference. Texture, age spots. It helps to rebuild the collagen, the elastin in your skin. And people are loving it, and they're loving the results that they're getting.
Well, I guess one of the huge advantages to that is that, again, it's all natural.
Yes, that's right. You're using
Yeah.
your own body to heal itself.
Right. So I would assume virtually no allergic reactions or side effects to that.
No, none at all. I mean, of course, with anything, there's always a side effects. Anytime that you break the skin,
Sure.
there's a risk for infection. I can say, knock on wood, we haven't encountered that,
Sure.
but I do have to let you know about it.
Of course.
But no, it's a really good alternative, and it's one of the only things that we can do for under the eye
So
without surgery.
okay. So I know you've got your mask in hand here.
Right.
And I know you wanted to mention that obviously with the times that we're in right now, of course, you're wearing a mask while the procedures are being done.
Yes, of course.
Okay, and then the patient, of course, has that choice as well. Okay. Any last thoughts? And we've covered a couple of things. We didn't want this to run too long, but just in summary, so basically, again, one of the uniquenesses to the process is that we encourage patients, of course. You don't have to know what you want when you come in. Just come in. That's the first step. And I think another compliment that we get from patients is that it's a complimentary. Like when you meet with them, if for whatever reason, again, they want to take that and think about it or process that a little bit, like there's no charge, because if it's something that at the end of the day that we want them to be completely comfortable. And so, I think that's important for the patient to understand. Obviously there's a lot of options. And you've touched on some of those. And then, one of the last parts is that, again, budget-wise, and I said that before, it's really important to understand, guys, that it's all about finding, again, what the patient wants, needs, and fitting it within their budget. I know with some of our patients, you've put a plan together because they've said, well, I want it all.
Right.
And, there's things you can do, obviously, again, with
the chin.
Yeah, talk about that real quick.
Okay. That's Cabela.
Okay.
From Allergan. And it can take anywhere from 1 to 3 treatments.
Okay.
And it actually takes this away. Now, I've only done one treatment, so don't be judging me right now. And it actually takes this away, but not only does it burn those fat cells up,
Okay.
it also tightens.
Wow.
And when I first discovered this new-ish product of theirs, I was concerned about that. Does it just leave the skin flat?
Right.
And that's exactly what we do not want.
Right.
So it tightens and it looks great, and we've been having great outcomes. And the thing is it doesn't come back.
Wow.
Once it's gone, it doesn't come back.
So it literally is eliminating, it's killing the fat cell.
Right.
Okay.
Get rid of that turkey neck.
Awesome.
So.
And I know that's a huge complaint, concern, desire for a lot of patients. So great. And with that being said, when some patients come in and they go, gosh, I've got this little, turkey neck thing going on. I've got all this that I need.
Mm-hmm.
You can put a plan together for them. But then at the same time, if they go, whoa, that's a little bit more than what the budget, right now will allow. So 2 things on that. One, they don't have to do it all at once, right?
No.
So obviously it's something where you can go, okay, let's categorize this into kind of a primary, a secondary, a tertiary. And then the other neat thing, and this is where that obviously, guys, that with all of our patients, and Heather does a great job on this, there's payment plans available, right? So this is something too that if a person says, well, okay, yeah, I do want to get it all done. Heather does a great job of sitting down and actually saying, okay, well, here's the different options we have, and there's actually 3 or 4 different options that we can put this in a budget form where they can literally put in an old payment plan that works out for them.
So whatever fits their needs.
Absolutely.
Yeah,
Okay. Awesome.
We can help them with.
Guys, again, we're gonna keep it at that for now. This is something, again, that we're probably gonna do a little bit more of, because there's a lot of information to share in this. Again, Karen, I really appreciate your time. And guys, if you have any questions, again, you can call us, 615-453-8999. You can obviously go to our webpage, which is Inspire. Help me with that, Heather. What is our webpage? Our website.
The aesthetic one?
Yes.
Inspire Medical?
InspireMedicalWellness.com. That's it. Okay, I had to think about that one for a minute. But InspireMedicalWellness.com. Guys, we'd love to be able to see how we can help you with this. So feel free to give us a call, look us up on Facebook, and guys, we look forward to seeing you soon. Have a great day.